All right. Welcome to the Auditory Learner. Um, this portion of this time that I'm doing the study guide is going to be for Pharmacology Chapter 13 and as well as Chapter 17. So 13 and 17, this is going to include um, the digestive system, antacid drugs, laxative, antidiarrheals, antiemetics, as well as asthma, respiratory system, COPD drugs, and treatment for allergic rhinitis, um, and stuff like that. Okay, so let's see how we're going to do this. Let's begin first by reviewing the the digestive system. Yeah. So as we know from previous experience, the digestive system starts at the mouth, and then it continues with the teeth. We grind up food, and then our saliva breaks things down as well, turns food into a bolus, and then along with the enzymes in the saliva, it goes down our gastrointestinal tract. The movement is caused by peristalsis, which is powerful, and even if we're upside down, it will still go in the same direction. Small intestines have villi that increase the surface area so they can absorb nutrients. Then bile from the liver breaks down fat, and then the large intestine's job is to extract water and the bacteria that live there break down the carbohydrates that we usually can't digest anywhere else. And then after about 12 hours, we're already excreting. One of the diseases for the digestive, a couple of diseases, two diseases for the digestive system that we're going to talk about are GERD and ulcers or peptic ulcer disease. GERD stands for gastroesophageal reflux disease, where it's people have a weak lower esophageal sphincter. And then the stomach acid escapes and causes a heartburn. So it kind of like goes up into the esophagus, the stomach acid that's supposed to stay in the esophagus. So the stomach acid escapes and causes the heartburn. This is a chronic condition, so it goes on for a while. And the esophagus has very little mucus compared to the stomach, which is why it affects um, the way it does. And then the next thing is going to be ulcers or peptic ulcers. This is usually bleeding in the stomach caused by Helicobacter pylori, which is a bacteria. This reduces the mucus in the stomach, and NSAIDs can cause this. Okay. Um, Also, really quick, we're going to talk about digestive system drugs. Okay. There are a couple different classes of digestive system drugs. There are acid reducers, there are acid neutralizers, which are antacids, and then there's bismuth subsalicylate, which is Pepto-Bismol. Um, so let's start with the acid reducers. Acid reducers are H2 histamine 2 receptor blockers. They are found, H2 receptors are found in the stomach. The drugs that are falling in this category of acid reducers, H2 receptor blockers, are cimetidine or Tagemet and famotidine or Pepcid. They are over the counter and which uh, cause histamine signaling, block histamine signaling. They're usually well tolerated, but they can cause dizziness, GI upset, headache, and QT elongation, which is an arrhythmia. Another drug that falls under this H2 receptor blocker acid reducer is ranitidine, Zantac. However, this one was removed from the market due to a carcinogen called NDMA. The next acid reducer we're going to talk about is proton pump inhibitors. These are omeprazole or Prilosec or esomeprazole or Nexium or Prevacid. These are more recent over-the-counter drugs, and they block the HK-ATPase pump directly and much strongly. Um, protease pump, I believe that's the name. And the proton pump inhibitors like omeprazole, they cause GI upset, dizziness, headache, they decrease calcium absorption, which can lead to osteoporosis. And it is a mild CYP450 inhibitor, which means they interact with other drugs. So that was the proton pump inhibitor, which is part of the acid reducers category. Okay, now we're going to go on to the next category of digestive drugs. We have acid neutralizers or antacids. We've heard about these. These drugs directly neutralize stomach acid, but they take a while for effect, and so they are altering of drug absorption. So some drugs like these are called TUMS, or calcium carbonate, or Rolate, or magnesium hydroxide. TUMS causes constipation and can cause hypercalcemia. Rolate, which is magnesium hydroxide, can cause diarrhea and can also cause hypermagnesia. The next drug that we're going to talk about is bismuth salicylate, which is Pepto-Bismol. This is treatment for many GI issues and thought to have an anti-inflammatory or antibiotic effect. And we recognize salicylate, right? That is, I believe that is like an aspirin type of ingredient, if I'm not mistaken. Bismuth has an oligodynamic effect and has a metal-like taste like copper. And it's the bismuth and the metal-like taste effect that is known to kill pathogens. Antacid, it is also an antacid as well, and it reduces motility in the stomach, but it's not really good at doing these things, but it is useful. Not good at doing these things, meaning that it does, but to a certain extent, but usually it's good to take before people go see a doctor for their issues, for their digestive issues. And so now we know what H2 blockers are, proton pump inhibitors are, and antacids, and how they work, and some of their adverse effects. The next thing we're going to talk about is just a quick little review. So TUMS is an antacid, omeprazole is a proton pump inhibitor, scopolamine is an antiemetic, and FLEET is a laxative. So let's move on to the next thing. So now we're going to talk about laxatives. Okay, and then we're going to talk about antidiarrheals, and then we'll talk about antiemetics. So we just talked about acid reducers and things like that. Those are digestive drugs. Let's talk about laxative type of drugs now, okay? So there is about 7 different types of laxative drugs, okay? These are, we'll start with Metamucil. This is a bulk type of laxative, which is taken orally, and the cellulose and fibers absorb water and add weight to the feces, and constipation is caused by dry feces, which is why people will take this type of laxative, the bulk type of laxative, which is Metamucil. The next type of laxative is a lubricant type of laxative, which is mineral oil taken orally as well, but it's not absorbed, it just speeds the feces excretion. The next type of laxative is a stimulant type of laxative called bisacodyl or Ducolax, and it's taken orally or through the butt, suppository. It irritates the intestine and increases contractions. Okay, that is the stimulant type. Then we have the stool softener type, which is docusate sodium, similar to the bulk type, but it has weaker effects and it attracts water to feces as well. So docusate sodium and Metamucil are similar, but Metamucil is bulk type and docusate sodium is a stool softener. Magnesium sulfate or FLEET is an osmotic saline type of laxative, meaning that it's given as an enema. All right, so Daniel, understand, compare and contrast and understand what an enema and a suppository is. I have a feeling that they both mean the same thing. So magnesium sulfate is called fleet, which is an osmotic saline type of laxative, as we just talked about, and it wets feces and speeds it along for excretion. The next two that we're going to talk about are in prescription is needed for these two. The other ones we talked about seems like they're over the counter, although it's interesting to think about that you can buy something over the counter that you can do this to yourself for. Anyways, there's a mu receptor antagonist, which we know that the mu receptor causes constipation. So if we give a patient like medicine like naloxegol, it will be the opposite effect. All right. So the mu receptor antagonist is naloxegol. The next thing is chloride channel activators, which increases intestinal secretions. So those were laxatives. And now let's talk about antidiarrheals. Antidiarrheals like Pepto-Bismol inhibit intestinal secretions, and opioid-like, but without the analgesia and the CNS effects such as the loperamide or atropine. It slows down the intestines, but there is no CNS effect. That was for that. Now let's talk about antiemetics. Antiemetics means prevention of vomiting. Okay, antiemetic means prevention of vomiting. And those are CNS antihistamines, which is the major mechanism going on there. Then there's first generation antipsychotics like chlorpromazine, and then there's anticholinergics like scopolamine, and then there's first generation antihistamines like Benadryl that can all be used as anti-vomiting drugs. Real quick, we just want to make sure that over-the-counter laxatives do not have systemic effects, okay? So that was chapter 13, okay, which is the review of the digestive system, antacids, laxative, antidiarrheals, and antiemetics. Okay. The next thing that we're going to talk about now is the respiratory system. All right. So, real quick overview of the respiratory system. It is the site for gas exchange, its immune response, and for speech. The medulla and the pons control the diaphragm. We have the upper respiratory system, lower respiratory system, and then the breathing control, which involves the lungs and the alveoli. For the respiratory system overview, we just know that, again, that it's immune response, speech, site for gas exchange, and also for cleaning and filtering particles out. Okay, then that's just a little quick overview. Let's talk about the upper respiratory system, which involves the nasal cavity, the pharynx. This area of the upper respiratory system warms and cleans the air. It alters voice, and it also controls smell, which is where we get smell from. The nostrils are elastic and they have hair on top to trap the dust. Nasal conchae are part of the ethmoid and the maxilla bone, and there's 6 total: superior, middle, and inferior. So 3 on one side, 3 on another side. The pharynx connects the nose to the mouth and the respiratory system. So there's the nasal pharynx, oral pharynx, and the laryngeal pharynx. The nasal pharynx is just right below the nasal conchae. The oral pharynx is just right directly behind in our behind our mouth. And the laryngeal pharynx is right before going down into the esophagus. The lower respiratory system involves the larynx and the trachea. You have a hyoid bone, which is attachment for ligaments, the epiglottis, which closes the larynx when swallowing. The trachea leads to the lungs, and it also has a mucociliary escalator, which is used to remove foreign objects that do not need to be going down there. It's a very important part of the immune system to bring things out. There's a part of the trachea called the carina, which splits the trachea into the main bronchi of the right and the left lungs. Asthma occurs at the bronchioles, and the trachea does not have smooth muscle. All right. And then you have cartilage, which supports the trachea. And these are things like the thyroid, the cricoid, the tracheal, the arytenoid, the corniculate, and the cuneiform. The corniculate and cuneiform are part of the vocal cords, which is like the outer structure of the vocal cords. Let's talk about breathing control, which the lungs. The lungs are a pleural cavity with 5 lobes. They're very vascular with inhalation that is driven by the diaphragm. There are 3 lobes on the right side and 2 lobes on the left side. There is a cardiac notch on the left lung. Both have an apex and a base, and bronchioles are the thing that's right before the alveoli. The alveoli is the part where gas is exchanged, and we have all these little capillaries, and they excrete surfactant and macrophages, and they present they also have a lot of vascularity on them, which we talked about there. One thing to know about hiccups is that it is a spasm of the phrenic nerve between C3 and C5. No treatment, but you can use antipsychotics for that. So let's talk about respiratory drugs now. We'll get into that later, actually. Let's talk about treatment for asthma and COPD. Asthma is inflammation of the bronchioles, and it increases secretion, shortness of breath, wheezing, and hypoxia. And an asthma attack is a combination of those. It's a sudden onset of these symptoms that we just mentioned. COPD is chronic bronchitis, and emphysema is destruction of the alveoli and the airway collapse, which is very serious, way more serious than asthma. Okay. Now let's talk about the various classes of drugs to treat asthma. Okay. We have corticosteroids, which inhibit the immune system. It's like stopping an itch, such as hydrocortisone taken by mouth or inhaled. Then we have beta-2 agonists, which are sympathetic agonists. They cause bronchodilation. This is albuterol. Albuterol is a beta-2 agonist. It's inhaled and absorbed in the blood. Its half-life is 4 to 6 hours, can cause tremors and dry mouth and anxiety. There's short-acting albuterol, which is used for mild symptoms, but it's used more frequently. Then there's long-acting for severe forms like COPD. So we talked about corticosteroids. Then we talked about beta-2 agonists. Then there's anticholinergics, used mainly for COPD and causes smooth muscle relaxation and bronchodilation. It's inhaled as well and causes xerostomia and hyperpyrexia. All right. So that was for that. Let's talk about allergic rhinitis, which is hay fever or allergies. That's like a runny nose, sneezing, itching, and red eyes. It's allergic rhinitis is not asthma. Okay. Allergic rhinitis is treated by H1 blockers, which are antihistamines. There's first generation antihistamines, which is Benadryl, which is over the counter, crosses the blood-brain barrier, Unisom, promethazine, hydroxine. Second generation antihistamines do not cross the blood-brain barrier with minimal sedation and a longer half-life. So that is that. I want to kind of just touch up on things here. Let's review here one more time. So let's talk about the drugs that we need to be very, very familiar with. So when it comes to drugs that reduce acid, all right, there are H1 blockers, which are cimetidine or Pepcid. These are drugs to reduce acid. Then there's proton pump inhibitors, which are omeprazole, lansoprazole, or esomeprazole, Prilosec, Prevacid, Nexium. Then there's antacids, which are Tums, calcium carbonate, or Rolaids, which is magnesium hydroxide. Then we have laxatives, which are Metamucil, which is a bulk type, mineral oil, which is a lubricant type, Bisacodyl, which is Dulcolax, a stimulant type, Docusate sodium, which is a stool softener, and magnesium sulfate, which is a fleet. I believe that one is given enema or suppository, if I'm not mistaken. Then there's the prescription type of laxative, which is naloxegol or Movantic, or lubiprostone or Amitiza. Those are prescription laxatives. Okay. Let's talk about antidiarrheals. Those are loperamide, Imodium, or diphenoxylate or atropine. Okay. Then there's antiemetics. This one is a weird combination here because it prevents vomiting, but it involves different types of mechanisms from different type of drugs. So it involves chloromaprazine, chlorpromazine, which is the first generation antipsychotic, dimenhydrinate, which is Dramamine, or it's also an anticholinergic. Then there's scopolamine, which is an anticholinergic, and diphenhydramine, which is Benadryl. Other drugs to reduce acid or digestive issue things here are bismuth subsalicylate, which is Pepto-Bismol. Let's get into the respiratory types of drugs here for COPD and asthma, or allergic rhinitis. Right. Okay. So the first ones are beta-2 agonists. Those are albuterol, metoprolol, which is Alupent, and levolbuterol, Xenopex, salmeterol. Those are beta-2 agonists. Then there's anticholinergics, which is clidinium, Tudorza, or revefenacin, which is Yulperi, anticholinergics. Now there's corticosteroids, which is prednisone, prednisolone, and fluticasone propionate. I believe that's the one that's inhaled. Insufflated. Then there is antihistamines, which is there's first generation antihistamines and second generation antihistamines. The diphenhydramine, Benadryl, doxylamine, Unisum, promethazine, and hydroxyzine. Those are first generation antihistamines. Then there's second generation antihistamines, which are cetirizine, Zyrtec, loratadine, Claritin, and fexofenadine, which is Allegra. Let's review again between first generation antihistamines and second generation antihistamines. Since we just talked about that, we just want to make sure that we know that the first generation, they do cross the blood-brain barrier and cause sedation. The second generation does not cross the blood-brain barrier, and there is minimal sedation. The insufflated one is fluticasone propionate. One thing about diphenhydramine, which is Benadryl, it is not suitable for daytime use. It causes xerostomia. Let's talk about the second generation antihistamines. They do not cross the blood-brain barrier. It's minimal sedation. They have a long half-life and generally stronger than Benadryl. All right. So that's that. Let's see if we need any more clarification for anything. We're just going to review here kind of everything that we need to kind of, just make sure that we remember. Make sure we know the difference between COPD and emphysema. Emphysema is like an airway collapse, right? COPD is like chronic bronchitis, which technically is inflammation of the bronchi, and inflammation of the bronchi is asthma. So COPD is just a more serious form of asthma. 8.3% of the US has asthma, all right? What else here? Make sure we know that other asthma and COPD drugs could be mast cell stabilizers or leukotriene antagonists or theophylline or anti-IgE antibodies. Because we know that the IgE is the allergic anaphylaxis one, since it's the mast cell site for those. Make sure we know what corticosteroids are, like hydrocortisone, and inhaled. They can be inhaled and used orally in more extreme cases. Yeah, you guys can tell that I'm tired. I'm tired of this. There's so much information. But I hope that this is good and this is going to give me an A on the final exam. All right. Uh, let's see. Anything else we need to talk about here? Let's just make sure we know what GERD is. All right. It's a chronic condition. Make sure we know heartburn. H2 receptor blockers are used for digestive antacid drugs. Okay. Proton pump inhibitors and all that stuff. So yeah, Daniel, make sure you know all this stuff. All right. You're gonna do great, man. You're gonna pass this class. Easy. Actually, it's not easy, but we'll end it there.